This is Lila Cortez. Radiation is still a mystery to people. It is often feared and misunderstood because they think that somehow it is dangerous. But before I start my discussion, let us first define what is radiation. So radiation is an energy emitted and transferred through space. So a common misconception about radiation is that it can cause cancer to people. But actually, radiation is everywhere. Human body. Our body is bombarded with low doses of energy all throughout the day, from the sources of heat, light waves, microwaves, from our cell phones, or even from our television. That is because we have the two classification of radiation. The first one is the non-ionizing radiation, which is the low frequency radiation, including the ultraviolet light, microwaves, and radio frequency. The second one is the ionizing radiation, which is the special type of radiation that is capable in removing an orbital electron from the atom in which they interact. So an example of this is like X-rays. So when a radiation particles interacts with atom, that interaction can cause the atom to lose its electrons and become ionized. So for each type of radiation that pass through matter, it is expressed in terms of penetration power. The more material the radiation can pass through, the greater the penetration power, but the more dangerous they are. So in short, the greater the mass present, the greater the ionizing power, but lower in penetration power. So an example of this is the alpha particles, because alpha has a huge or greater mass. High sustained doses are both damaging and devastating. Radiation can disassemble atoms that will cause DNA damage to cells, leading to serious side effects such as cancer. Ultraviolet lights from the sun can increase the risk of melanoma or other skin type cancer. High doses of ionizing radiation can also affect organs, including the radon. It is linked to increase the risk of lung cancer. But cancers are just possible if we overexpose ourselves into radiation. Like in radiography, we limit the exposure time as possible, and we also have this so-called exposure factor and exposure technique guide, of course, to produce the radiation that is really suited to the patient to avoid risk and danger. And other people also wear protective equipment, of course, to lower the doses of radiation that will come into their body. Another thing that contradicts the idea that radiation can cause cancer is, according to the American Cancer Society, radiation therapy is one of the most common cancer treatments. So they use radiation to kill cancer cells. According to the Radiological Society of North America, an average person can receive 3 MSV of radiation from their surrounding environment over a course of 1 year. So in comparison to that, an average chest X-ray is equivalent to 7 days of exposure, and a dental X-ray is equivalent to 1 day exposure. CT scan for the head is equivalent to 8 months of exposure. So we only get a small amount of radiation in every exposure to those imaging facilities. Radiation cannot cause cancer in just a single exposure. It is far different from what people think radiation can cause them.
Misconceptions occurs because people make conclusions without basis and without understanding it. Just like radiation, there are many misconceptions regarding this, but the most common is that it is deadly and lethal. People are bad at judging risk, and the word radiation, combined with the fact that we can see or control the invisible forces emanating, becomes the perfect recipe for fear. Radiation isn't it a scary word? It's tempting to imagine massive explosions and horrific aftermath nuclear accidents. But that's not the full story. Radiation is defined as the emission or transmission of energy in the form of waves or particles through space or through a material medium. It can be classified into two, which is the ionizing and non-ionizing radiation. Non-ionizing radiation is any type of electromagnetic radiation that does not carry enough energy. This includes visible lights, infrared rays, microwaves, radio waves, etc. And ionizing radiation is a type of energy released by atoms in the form of electromagnetic waves or particles, and this includes X-rays and gamma rays. We are daily exposed to low levels of ionizing radiation. For instance, it may shock you that I am a radioactive. Even the food you eat, specifically bananas, which consist of potassium and considered as radioactive, and you is also radioactive. So, the question is, are we supposed to be afraid of radiation? For example, gadgets. I take this as an example because most of our parents ginisingkit tungod sini masagad. Sige mo na cellphone, di ka na nakakapangina no. Radiation mo dito. Gadgets like cell phones are classified as the non-ionizing radiation. Cell phones are low-powered radio frequency transmitters, whereas radio frequency is a type of non-ionizing radiation which is at the low energy end of the electromagnetic spectrum. So, meaning, dili siya nakakaharm sa tao. And according to the Food and Drug Administration, scientific evidences says that cell phones radiation doesn't harm humans. Though, there are scientific evidences that cell phones doesn't cause harm, still, there's a but. Using gadgets in moderation is better to prevent yourself from risk or harm that might lead to a serious problem. We are surrounded by radiation everywhere. However, much of that radiation is non-ionizing. So, let me end this video with a statement. To overcome fear, we must understand the unknown. I am Eliza Zane B. Nunez, BSRT2, and this is my 3-minute video talk.
Hello everyone, I am Althea G. Capsa, a BSRT2 student, and since I am in the Bachelor of Science in Radiologic Technology, I am here to address some of the misconceptions about radiation. So I'll start it off with my own experience. Before I entered this course, a lot of people were asking me na, nano kay mag-radtech ka? Di ba nakakabaog iton? Di ba nakakalagas iton buhok? So before, as someone na waray pa masyado idea about this course, I asked first one of my friends na medyo familiar na about this field, and so she told me that it was all just a misconception. And now that I entered this course, it really helped me a lot. It enlightened me from all those misconceptions, and it gave me more idea about this field. And since kada mo sa nahadok sa radiation, nano ba talaga ang meaning sa radiation? So radiation is any energy emitted or transferred through space. From that definition, we can actually say that radiation is everywhere. Radiation is present in light, and in sound, and in many more. Actually, potassium-40 is a radioactive substance that is natural metabolites, which means that our body can actually take it in. Radiation is also classified into two, the ionizing radiation and the non-ionizing radiation. So the non-ionizing radiation usually comes from the gadgets that we commonly use, such as mobile phones, that actually doesn't cause us any harm. While ionizing radiation can actually possibly cause us any harm, but with the proper usage, with the proper equipment used, and with the help of RadTechs that gives the patients proper dosage, it will not cause us any harm. So I am reminding you not to be afraid of radiation, as what our professor always reminds us. This line is from Catriona Gray. Everything is good, but in moderation. So to end this video, may I just remind you not to fear radiation, because radiation actually cures patients, and fear will bring us to nowhere. Again, with the proper usage, radiation will not cause us any harm. That's all. Thank you.